Mike Huckabee opened his show the other night with just a laughably stupid monologue.
This week, we learned that more than 3 times the number of people signed up for free Obamacare through Medicaid than who signed up for a plan that they would pay for. Oh, and many of the ones who are paying, they're only going to pay part of the cost thanks to the generous subsidies. So let's say Obamacare is like a hamburger. And suppose hamburgers cost $5. And 85% of the people have hamburgers, they like the burgers, and they think $5 is a good price for them. But it's not fair that 15% of the people didn't have hamburgers. So we're going to create Obama Burger. That will create universal hamburger access. Now, true, some of the 15%, they don't have hamburgers because they're vegetarians, and some because they'd rather have a hot dog. So they're really only about 5% who truly can't get hamburgers. But with Obama Burger, we're going to have to raise the price of the $5 burger to $7.50. And that's because those who used to pay $5 will have to pay for the ones who don't have any burgers. Now, some people are going to get Obama burgers for free. Others are going to only pay $2 for the $5 burger that now costs $7.50. But so many people have decided they want free burgers, and they want the $7.50 burger now for $2, that the people who used to buy the $5 burger and thought they would at least have to pay $7.50, well, now they're actually going to have to pay $10 for their burgers to make up the difference from all the free ones and the ones who are being given at a reduced cost. So here's what we're going to do. We want to do our part. So we're going to give all the folks here in our studio audience a coupon. That's right. It's a coupon that will let them pay $10 for the $5 Obama burger. Now, it's not a coupon that lets them have a $10 burger for $5, but lets them have a $5 burger for $10. You follow me so far? Well, some of the customers, they don't want the deluxe burger because they can't afford it. But, you know, we think everyone should have a burger with lettuce and onion and cheese and pickles and tomatoes and mustard. So you're going to have your burger our way, not yours. Oh, and you will pay for all the extras, even if you don't like them or even if you're allergic to them. Now, if that sounds utterly ridiculous, it's because it is ridiculous. But that, my friend, that is Obamacare.
Yes, Mike, universal health care is like universal hamburgers. I could just see economists contemplating suicide as they're listening to Huckabee's moronic rant. Now, would you like me to explain how the health insurance system in the United States actually functions, how a private system functions versus a public or government-run system functions? So in the U.S., we have private insurance companies. In the other modernized industrial nations, it's a public insurer. It's called a single payer. That single payer is the government. They are the sole insurer when it comes to healthcare. Now, private insurance companies here at home, they are a cash-sucking middleman, a for-profit middleman, that their job is to get as much profit as they can off of you, and they have a fiduciary responsibility to their shareholders to maximize profits. Now, the problem is that there's a perverse incentive in a private insurance system. And what I mean by that is, how do they make money? They make money by denying more care. The more care that they deny to you, the more claims that they don't pay out on, the more money they have for their shareholders and for their stock to go up. So there's a perverse incentive for private insurance. When it comes to the government doing it, what they do is very simple. Everybody pays a flat rate or a progressive rate right out of your taxes, however much, 3%, 4% of your taxes. Everybody pays into the healthcare system, and then when you get sick, you get help, period. And also, I should mention, private insurance in the U.S. is way more expensive than public insurance in any other modernized industrial nation. So he's making it seem like Obamacare is ripping you off and government health care would rip you off, when the reality is the private insurance system rips you off. Because again, they have to pay the cash-sucking middleman, where in other modern industrial nations, they don't have to do that. And also, I mean, Mike, he's comparing health insurance to hamburgers. Yeah, health insurance and health care you need in life. You don't need a hamburger. And also, there are, there's no hamburger insurance system. There's a health insurance system and a health care system. They're two separate things. But he's like, oh no, health insurance is like hamburger insurance or just flat out hamburgers. No matter how you try to slice it or dice it, his analogy makes no sense, because one is a necessity, and the other one is not a necessity. The other one is a consumer good. It's like comparing, Obamacare to scooters.